The connection between diabetes and stroke. Why does diabetes often lead to stroke? The connection between diabetes and stroke has to do with the way the body handles blood glucose to make energy. Most of the food we eat is broken down into glucose to give us energy. Glucose enters a person's bloodstream after food is digested and travels to cells throughout the body. For glucose to enter cells and provide energy, it needs a hormone called insulin. The pancreas is responsible for producing this insulin in the right amounts. In people who have type 1 diabetes, the pancreas does not make insulin. In people who have type 2 diabetes, the pancreas makes too little insulin, or muscles, the liver, and fat do not use insulin in the right way. As a result, people with untreated diabetes accumulate too much glucose in their blood, and their cells don't receive enough energy. Over time, excessive blood glucose can result in increased fatty deposits or clots in blood vessels. These clots can narrow or block blood vessels in the brain or neck, cutting off the blood supply, stopping oxygen from getting to the brain, and causing a stroke. What are the major causes of stroke in people with diabetes? Diabetes is a major risk factor for stroke, and it is estimated that people with diabetes are 2 to 4 times more likely to suffer a stroke than those without the condition. While there are several potential causes of stroke in people with diabetes, the most common include high blood pressure, high cholesterol levels, obesity, physical inactivity, and smoking. It is important for people with diabetes to understand the risks associated with these factors and take steps to reduce their likelihood of suffering a stroke. What is diabetes and what is a stroke? Diabetes and stroke are two of the most common health conditions that affect millions of people around the world. Diabetes is a chronic disorder in which the body does not produce enough insulin or cannot use insulin properly to process sugar. A stroke is an interruption of blood flow to the brain caused by either a blockage or rupture of a blood vessel, leading to damage of brain tissue. Both diabetes and stroke can have serious consequences if not managed properly, including disability, paralysis, and even death. It is important for people to understand both diabetes and stroke in order to take measures to prevent or manage them if they occur. How high blood sugar levels can lead to an increase in risk for stroke. High blood sugar levels can be a serious health issue that can increase the risk of stroke. When blood sugar levels are too high, the body is unable to effectively break down and absorb glucose, leading to an increased buildup of glucose in the bloodstream. This can cause damage to the arteries and veins, making them more prone to rupture or blockage. As a result, an individual with high levels of blood sugar is at greater risk for stroke due to this increased risk for blockages in the vessels that supply oxygenated blood to the brain. In addition, high blood sugar levels can also lead to an increased risk of developing diabetes, which further increases one's chance of having a stroke. Diabetes and its effects on the cardiovascular system. Diabetes is a chronic condition that affects millions of people worldwide. It has a significant impact on the cardiovascular system, as it can lead to an increased risk of heart disease and stroke. High blood sugar levels can damage the walls of blood vessels, leading to atherosclerosis, which is a narrowing and hardening of the arteries. This can increase the risk for heart attack and stroke. Additionally, diabetes increases the risk for high blood pressure, which further damages the cardiovascular system. Therefore, it is important to take steps to manage diabetes in order to reduce its effects on the cardiovascular system. How uncontrolled diabetes can increase risk for stroke. Uncontrolled diabetes can be a serious health risk factor for stroke. When blood sugar levels are not well managed, it can lead to the narrowing of the blood vessels and increase the risk of stroke. High levels of sugar in the bloodstream can also cause damage to the brain, leading to an increased risk of stroke. Additionally, uncontrolled diabetes can lead to high blood pressure and cholesterol levels, both of which are known risk factors for stroke. It is important to take steps to manage diabetes in order to reduce the risk of developing a stroke. Preventing strokes in patients with diabetes. Strokes are a major health concern for patients with diabetes, as they are at an increased risk of stroke due to their condition. It is important to take preventive measures to reduce the risk of stroke in diabetic patients. This includes lifestyle modifications such as regular exercise, healthy eating habits, and avoiding smoking and excessive alcohol consumption. Additionally, controlling blood sugar levels can help reduce the risk of stroke in diabetic patients. Regular monitoring of blood pressure levels and cholesterol levels should also be done to help prevent strokes in this population. Conclusion: taking control of your health and reducing your risk of stroke. Taking control of your health is an important step to reducing your risk of stroke. You can significantly reduce your chances of having a stroke by making lifestyle changes such as eating a healthy diet, exercising regularly, and reducing stress levels. Additionally, regular checkups with your doctor and monitoring blood pressure and cholesterol levels can help ensure that any warning signs are detected early. Taking these steps now will help you lead a healthier life and reduce the risk of stroke. Thank you for watching the video. Please do the video like, share, and subscribe to the channel.